Nalbuphine is a safer alternative to sufentanil as an analgesic agent in patients undergoing colonoscopy. Colonoscopy is an effective diagnostic procedure for diagnosing colon, rectal abnormalities, and screening colorectal cancer. Colonoscopy involves pain and discomfort, therefore, the patients are administered with sedative and analgesic agents. Analgesic agents that do not cause significant respiratory depression are used to control preoperative pain. Nalbuphine hydrochloride is a mixed agonist-antagonist opioid that acts on certain opioid receptors, thereby preventing the pain. When compared to other opioid drugs, the incidence of side effects caused by nalbuphine is low. Sufentanil is an opioid fentanyl analog, which is also used for analgesia. It causes analgesia by acting on certain receptors that cause pain. There is a risk of hypoxemia and apnea associated with sufentanil. The study objective was to compare efficacy and safety between nalbuphine and sufentanil in patients undergoing colonoscopy, and also to determine the optimal doses of nalbuphine for colonoscopy. A randomized, controlled trial was conducted, and 234 patients were enrolled in the study. The study included patients of age 18 to 65 years and having body mass index of 18.5 to 30 kg per square meter. Patients with history of abnormal recovery from anesthesia, abuse of narcotic analgesics, acute airway inflammation, neuromuscular disease, abnormal heart rate, blood pressure, or opioid allergy were excluded. The patients were randomized to receive either sufentanil or nalbuphine. There were 4 study groups consisting of 1 sufentanil group and 3 groups of nalbuphine. All the patients were administered propofol for sedation, and their baseline vitals were recorded. The intensity of pain was assessed using visual analog scale and the modified behavior pain scale for non-intubated patients. Nalbuphine and sufentanil showed similar pain relief activity in the patients. There was decreased risk of nausea in patients who received nalbuphine. There was low incidence of respiratory depression in patients who received nalbuphine when compared to sufentanil. It was concluded that nalbuphine can be a reasonable alternative to sufentanil as an intravenous analgesic agent in patients undergoing colonoscopy. There was a low incidence of respiratory depression and decreased the risk of apnea during colonoscopy with nalbuphine. Therefore, nalbuphine can be a drug of choice in patients with respiratory problems.